I want to talk about what's happening in Canada first, and then talk about how America is slowly becoming just like Canada. So, concerning stuff, but Canada is a few steps ahead of us. Justin Trudeau right now is trying to push for digital IDs, is what they're talking about. Let me show you this. This is the Gateway Pundit. It says Justin Trudeau hijacks Canada's healthcare and threatens provincial premiers to cut off healthcare funding unless they agree to digital health ID. Now, what you're watching here is the I'd say natural progression of socialist medicine. Whether it's the government trying to mandate ways to track people using digital IDs or whatever else, or it's the promotion of the MAID program, the medical assistance in dying. Both of these, I think, are outgrowths of socialist medicine for two reasons. Medical assistance in dying is being promoted because it's cheaper to kill you than it is to treat you in some cases. And if the government, with limited funds and everything state funded, knows that there's no benefit, if there's no financial benefit in keeping you alive, you're merely seen as dead weight on the system, they want to get rid of you. They no longer see you as useful for the good of the collective, right? That's the frequent end game we find under socialist regimes. MAID, medical assistance in dying, or you call it euthanasia, or as I like to call it, murder, is just like that. And it's really being promoted for that exact reason. The other side of it is accountability and tracking. They want to make sure that people are not ripping off the system. They want to make sure that people who claim they're disabled are actually disabled. They want to have ways of monitoring things because, big government's all about data. When it's governed from the top, they need to have data to inform their decisions. One of the big shortcomings you find, not just in socialism, but with any kind of tyrannical system, the lack of, let's say, understanding of the minor nuances that take place when something is practiced at the ground level. Something that Ludwig von Mises would criticize as one of the shortfalls of interventionist policy. You try to govern from the top. You don't understand the nuances on the ground. If you try to create a one-size-fits-all solution, you're going to find that it ends up breaking a lot of things as it gets down to the ground level. Another big problem with that. One of the ways government's trying to get around that is with big data and with really minute ground level monitoring. And in Canada, one of the things being promoted for that is digital ID. Let me show you. It says on Tuesday, Prime Minister Justin Trudeau announced the federal government's commitment to spend $196.1 billion on healthcare over the next 10 years. According to reports, the proposal comes with the condition for digital ID data collection. Trudeau is trying to blackmail, this is their assessment, right, to get Canadians to sign up for the digital ID. Canadian news outlet Star reported back in October that federal sources said Trudeau was ready to freeze out Quebec and other provinces in federal healthcare deals. CBC says this. To access the enhanced CHT, provinces must first commit to improving how health data is collected, shared, and used and reported to Canadians to promote greater transparency on results and to help manage public health emergencies. In the United States, they're promoting this as well. This is not just Canada. They want to also have your digital health code, your COVID-19 passport. At the World Economic Forum, they're talking about digital health ID systems as well that also have all your medical information, all your personal information. In China, they have that as well. Your digital health code on your smartphone, which is why, again, when we noted there were suddenly a huge drop in these smartphones, was of concern, is because you can't just get rid of them. Because your health code, which you need your smartphone for, contains not just your digital ID, not just your ability to enter buildings or leave your home, but also all of your personal medical information and also all of your social credit system scoring, which determines whether you're a good citizen or a bad citizen. And it's not just this as well. In Canada, they're also pushing for new levels of censorship. Actually, they're very close in terms of where they're at with censorship. They're very close to what's happening in some parts of Europe. Post Millennial has this story. It says Trudeau's internet censorship bill has passed the Canadian Senate. It says the Canadian Senate on Thursday voted to pass an online censorship bill C11, sending the controversial piece of legislation back to the House of Commons and one step closer to becoming law. Now, in Canada, there's a good chance it could get passed. Further, it states the text of the bill describes the plan by Justin Trudeau's Liberal Party to increase the government's ability to censor controversial and unpopular speech on the internet, stating that the legislation would specify that the Canadian Radio, Television and Communications Commission must regulate and supervise the Canadian broadcasting system. In other words, deeper government control over content. It says, according to the Freedom Activists, the Liberals' bill would give the CRTC, this organization, again, Canadian Radio, Television, Telecommunications Commission, it would give the government, in other words, it says, power to regulate any online streaming service they wanted, including that of private citizens. If you run any kind of online information, you would fall under the control of this governing body were this thing to get passed, and it's well on its way to getting passed. It says critics of the censorship bill have likened it to the policies of authoritarian states like Nazi Germany or the Soviet Union. And there's a quote here: "Wake up, Canada! Trudeau's Senate bill Trudeau's Senate passed Bill C11 today, aka internet censorship, which is anything that opposes their narrative. Stalin and Hitler did the same." It's Canadian social media commentator Liz Churchill writing. Now, you could also say it's something that Fidel Castro would probably do, or maybe even like maybe the unofficial child of Fidel Castro. Someone might do that, I would imagine, as well. Folks, it's not just Canada doing this. It's not just in Canada you're seeing stuff like this. You're also seeing policies like this happening in Brazil now under Lula. You're seeing this being pushed very strongly in many parts of Europe. Australia has policies like this. In the UK, I mentioned yesterday that video game companies, Ubisoft in the main case, is even working with law enforcement to report people on what people are saying over online chat. There are programs here in the United States monitoring what you say on Facebook and reporting you to authorities, and even having people labeled as terrorists for really just making just what are obviously jokes on the internet. You even had a mother, as I mentioned yesterday as well, who was unhappy about some of these LGBT, posters and so on being put up at schools, and was labeled a domestic terrorist and had the military sent against her because she was criticizing this. Not because she did anything, but because she wrote on Facebook her discontent with the way this was being done. She does not support the sexualization of children, and that got her labeled as a terrorist. In other words, this is not just Canada, this is here as well. And let me show you where this is going. Because in some places in the United States, they're beyond the discussion on digital ID. Keep in mind as well that actually they're going to be rolling out digital ID in the U.S. very soon. In fact, they're even talking about having it as being necessary for airline travel and so on. But in Alabama, folks, Democrats want to ban employers from forcing workers to get microchipped. I applaud the Democrats for actually standing up against this, in fact, because there are people right now pushing for this. And I would, if an employer wanted me to get microchipped, I would walk out the door in a heartbeat. I would not do it. But it's happening right now. It says here, Alabama Democrats want to make it illegal for public and private employers in this state to force their employees to get microchipped. Again, you have this happening. A bill pre-filed for the state legislature's upcoming session will make it a felony for state agencies, private businesses, insurance providers, or bail bondsmen in the state to require employees to be implanted with a microchip as a condition for employment or services. The bill defines a microchip as a device subcutaneously implanted in an individual that is passively or actively capable of transmitting personal information to another device using radio frequency technology. In my personal opinion, They should actually make this a bit broader in definition. Some of this does not transmit any kind of signal. Some of it's merely like a tattoo to mark you, like a QR code, which can be scanned and be used to access your medical records and so on, like that, or who knows what else, whatever they want to keep on you. Basically, they want to give you a mark. They want to give you a tattoo. They would work basically like a QR code. They already have iPhone apps or smartphone apps. They can scan your mark wherever, maybe on your hand or your forehead, right? They want to have this mark on you that could be scanned easily, which would show all of your citizen data. Now, that would not be something that is transmitting a radio frequency, but because of scanning technology, would work in the same way as basically being microchipped, right? You're not having an electronic component installed on you, but it is a digital ID that, using facial recognition technology or just QR code scanning technology, would have the exact same function, almost, because it's not an emitting system. But back to this report, it says the term does not include any device used in the diagnosis, monitoring, treatment, or prevention of a health condition that only transmits information necessary to carry out the diagnosis, monitor, treatment, or prevention of that healthcare condition, the bill states. The bill is being sponsored by Alabama State Representative Prince Chestnut and co-sponsored by House Minority Leader Anthony Daniels and State Representative Kelvin Lawrence, all Democrats. And folks, I applaud them for this. Good on the Democrats for taking a stand against the idea of microchipping people.